Hello, I'm Dr. Molesky, and I'd like to welcome you to this video on peripheral neuropathy. And I want to let you know that you made a very wise decision to watch this video, because you're going to find real answers to a different approach to diagnosing and treating peripheral neuropathy. I find people are very frustrated. They come in our office and they're looking for answers. They've been to their doctors and the specialists, and nothing helps them. I had a gentleman come into my office a couple of years ago who had tremendous pain in his feet at night, and he was in tears at night, his wife told me, and he couldn't sleep at all. The only thing that gave him any relief was to have his wife rub his feet. And so she wasn't getting any sleep, he wasn't getting any sleep, none of the pills helped him. He'd been to all kinds of specialists, all kinds of doctors. Well, he was really intrigued to hear about our alternative type of approach to chronic problems. We do what's called integrative or functional care. And he got better. It didn't take long either. 2 to 4 weeks down the road, he was sleeping through the night, sleeping like a baby. His wife was real happy about that as well. So let's talk about that. What we provide is called functional care. And some people call it functional medicine. It's integrative care. It's not your standard care, what you typically get when you go to seek medical help for a condition. And we call this functional, and you kind of relate to it to a watch. These fancy Swiss watches, if you open the back up and you look inside, you're going to see all kinds of gears in there. Little gears, big gears, little levers, and they all work harmoniously together to make the watch run right and keep the right time. Well, your body's like that. You have all these little gears inside moving in there. You got gallbladders, livers, digestive system, brain, pancreas, all different, your whole body has to work in harmony for the body to be healthy. Well, if the smallest gear breaks down, you're going to have a problem. And the watch may run slow, your body may not work as well. It'll then start affecting other gears, and then another gear goes down, the watch runs slower, and enough of them are affected, eventually the watch stops working. Well, the body is that way. The body needs to function right to work right. If the body breaks down, these gears start going bad, your body won't work right, and when it doesn't work right, it'll give you symptoms. So this is basically what we're about. We're about function. We don't diagnose or treat problems, really. What we do is we evaluate you and look for systems that aren't working right, something's malfunctioning, and we want to correct the function. If you correct the function, you're going to correct the problem. So why should you listen to me? Well, I live and breathe this stuff 365 days a year. I just love what functional medicine can do for people with chronic conditions. I've been in practice for over 36 years, and I've attended thousands of hours of postgraduate education. My degree is in chiropractic, and I want to talk about that a little bit because people have a misconception about what chiropractic is. I come from a very medically oriented family. My grandfather was a pediatrician and my mother was a registered nurse, and so we were very tailored medically. My grandmother always encouraged me to become a doctor, and so much so that I always wanted to help people, and I thought this is a great field to get into. So I was taking pre-med courses. My desire was to be a surgeon. And during the course of my pre-med, my sister developed really bad migraine headaches where 3 or 4 days a week she was incapable of function. She's in her room vomiting, the lights bother her. She was horrid. She had been to all kinds of specialists. I'm talking to my professors, what can we do for my sister? And they tried all kinds of medicine, nothing worked for her. And she was miserable. It was just unbelievably bad. Well, one of her girlfriends says to her, why don't you go to my chiropractor? And I thought, why are you going to go to a chiropractor? What is that? I didn't know what it was, but I didn't think you should go to one. But to my surprise, she said, yeah, I'll go. Well, she went to this chiropractor, and within about a week or two after going, all of a sudden her headache started getting better. And I thought, it's probably coincidence. Well, after about a month, she didn't have any migraines anymore. Well, I kind of ignored that, and I continued on with my studies, and about, maybe 9 months later, my dad, he had had a heart attack, and when he had his heart attack, they put him on a no-cholesterol diet. And so he was boiling his meat to get all the fat out of it, and he wouldn't eat anything with anything that had any semblance of cholesterol in it. Well, he started developing pains and inflammations. His wrist started swelling up and getting a lot of pain, and he wasn't a sissy kind of guy. And so much so that he would never go to a doctor. Well, he went to the doctor, and the doctor said, well, you developed rheumatoid arthritis. And so he gave him some medication for it. And he took the medicine, and the pains went away, the swelling went down. We're good. Well, about 3 months later, he has a heart attack. He's in the emergency room, And they said, oh, no, it's not a heart attack. Your heart is fine. What the problem was, you had a side effect to the medication you were taking. And he said, well, I'm not going to take it anymore. Well, wow, things really got bad then. He stopped taking the medicine, and I mean, his wrist blew up like the size of a grapefruit. And I mean, his skin was ashen gray. He was like the Walking Dead. And we had to help him out of chairs, and the pain he was in was unbelievable. But he was stubborn enough to where he was not going to take anything to relieve that pain, because the thought of having another heart attack just scared him worse, I guess. Well, my sister comes up and says, why don't you go to my chiropractor? I thought, give me a break. Why would you go to a chiropractor for rheumatoid arthritis? Well, he says, I'll go. And I said, well, I was surprised he went, but he went. And I'll be darned if he went to this chiropractor and the chiropractor looked at him, changed his diet, gave him exercises to do and different things, and 2 weeks later, his pain subsiding, his wrist went down over the course of the next couple months, and skin color came back, and it's like, whoa, this I found amazing. No drugs, no surgery, and the body healed itself. So I went and I learned more about what chiropractic was about, and what I found was that it's really one of the largest natural healing professions in the world. I turned, by the way, from pre-med, I went into chiropractic because I thought this was awesome. And I was in chiropractic college for about a year before I found that people went to them for back pains. I never knew that. I thought it was for health problems and, about wellness, because chiropractic is all about structure, function, exercise, diet, nutrition. It's what we do. And that's what my focus has always been on in chiropractic. So during these years now, I've taken a lot of postgraduate courses, and I've graduated the American Functional Neurology Institute. And what functional neurology is we look at how the nervous system is functioning. When you go to a medical neurologist, they're looking for hard impairments like hard lesions, like brain tumors, strokes, things like this. What we're looking for is the left side of your brain functioning as strongly as the right side? Is there a balance there? Because if there's an imbalance, your brain can get ill and not work right, just like your stomach or your heart and liver. Brains do that. And so this is a very specific type of testing that will tell us what's imbalanced, and we want to balance those. I'm also board certified in integrative medicine. And integrative medicine collates everything. And we look at the body as a whole. We want to find out what's functioning. If your body's functioning right, it will function right of all the organs. So again, we don't want to look at you as a label and say you've got this disease and what you do about it. We look at what's not working right and fix the function. Too often today we go to specialists. You go to your stomach doctor, your lung doctor, your heart doctor. What's the whole body doing? And that's what integrative care is about. And some people call it functional medicine, functional care, metabolic care. So during this video, we're going to cover several things. We're going to talk about what peripheral neuropathy is. We're going to talk about the causes of it. We're going to tell you about the metabolic evaluation and therapy to correct it, neuropathy, and then the neurological aspect as well. So let's start off with what is peripheral neuropathy. Well, millions of Americans have it. Americans have it more than anybody on the planet. And there's reasons for that. Basically what happens is the electrical wiring in your body breaks down to the point that your feet don't communicate with your brain, or your hands don't communicate with your brain, and vice versa. And there's a feedback cycle that's always going on. When you walk, your brain knows where that foot is. And some of the reasons people are imbalanced and have balance problems is because they have neuropathy in their feet, and it causes them to fall. And falling is a really bad thing for people that are over age 65, or any age for that matter. So it's really important to have that communication going there, so your feet do know, and your brain does know where your feet are. So let's talk about signs of neuropathy. A lot of different symptoms. Some people have one or two of them, some have many of them, but basically you're going to have a burning, tingling, numbness, cramping, pain to walk, pain at sleeping at night, prickly feelings. So the feelings you're having is dependent upon what type of nerve is affected. And there's basically three types of nerves. The first are sensory nerves. These nerves, just like it sounds, have to do with sensation. So if you have numbness, tingling, pains, those are sensory nerves. They're a thick nerve that have a big, what's called a fatty sheath around them. If this fatty sheath breaks down, you're going to start getting these type symptoms. The other one would be control muscles, and these are motor nerves. And the motor nerves control the muscles. And so that's what gives you strength. I have had people come in for consultation that were wearing braces on their feet because they lost control and they can't hold their feet up. And it's called foot drop. Well, that's the worst kind to have. If you have muscle problems like that longer than 2 years, it's irreversible. You can't change that. And the third type is it affects autonomic nerves. And these are nerves you don't think about. When they say autonomic, is because it happens automatically. And these are going to the capillaries and the small blood vessels of your body. So it's going to areas that like your digestion, heart rate, lungs, things you just happens subconsciously in your body. And so you're not even aware you have that going on. So if you have tingling in your feet, you may have autonomic things going on as well. So now let's cover some of the causes of peripheral neuropathy. The first would be medication side effects. You're going to have imbalances in your nerve system, in your brain. You can have damage to your spine, thyroid, adrenal dysfunctions. You can have metabolic problems with sugar metabolism. You can have infections or inflammation in your system, food sensitivities. And we're going to go ahead and talk about those now. First off, medication side effects. That is self-explanatory. Any medication you're taking, you should look up and find out what the side effects are. If side effects are burning, numbness, tingling, neuropathies, maybe that's not the best drug for you to be on. So you want to check that out. Then we want to look at imbalances in the brain and nerve system. And this is so important. Your brain is a master computer. And if the computer's got a virus in it, it won't work right. Well, your brain's the same thing. It's got to be functioning properly. Your brain perceives pain. And pain is perceived in the brain. So you may have heard stories where people have they lost a foot. And they'll sit there and say, my foot hurts, but they don't have a foot. That's because pain is really being sensed in the brain. So if that brain is not functioning properly, you could be feeling pains down here, and the problem is really with inflammation or a problem in the brain, not the foot. So you need to find out if that's what the cause of your neuropathy is. These nerves connect to the brain and vice versa. And if those nerves are breaking down because of dietary things, inflammation, we need to rebuild those nerves. There's another thing called nerve pathway fatigue. And if you're going to exercise a muscle, let's say you get a weight and you start doing this, after a few minutes, that muscle gets tired. Well, your brain does the same thing. If you have a chronic type of a problem that's sending the same signal up one side of the spine, up to the other side of the brain, over and over and over again, the brain gets tired and it kind of shuts down and lulls into like a funk. Well, if you have that going on, 60% of your brain suppresses other functions. So that's an area that suppresses pain, that's why you're feeling pain, because that area of the brain is actually sleeping. We want to wake that pathway up. Another thing is damage to the spine. This picture shows a sciatic nerve coming from the low back down to the toes. Well, the same thing, you have a problem in your neck that goes down to your hand. If your neuropathy is one-sided, like in one foot or one hand, we very much suspect that your problem is related to the spine. In the spine, there's little holes that come out that the nerve travels through, and if that hole is squished down, they call that stenosis, it can pinch the nerve or irritate the nerve. And obviously the answer to that is to change that stenosis so you can free that nerve up. This can be caused from degenerative discs, arthritis of the spine, herniated discs, bulging discs, things like that. Now we're going to talk about sugar metabolism. You can have insulin resistance, hypoglycemia, diabetes. Blood sugar should be between 82 and 99 on a readout. If it's below that or above that, nerves are affected. Your nerves will not function right. You're killing off nerve cells. Just because you have diabetes does not mean you can't get better. Diabetic neuropathy, you've probably heard of if you're a diabetic. I can't tell you how many people come into my office that have gotten off their diabetic medication or lowered it down tremendously to where it's not an issue and they get relief from their neuropathy. You are not hopeless. It takes determination, it takes time, but it is workable. With diabetics, the one thing that really drives that whole sugar is cortisol. We talked before about how cortisol levels coming out of your adrenal glands can cause neuropathies. And what it will do when it's elevated, it will raise up your blood sugar level. And we want to get that blood sugar level down so that the sugar is not down on the nerve and compressing the nerves. So that's basically what happens. And the reason you get it in your toes is because the toes are a long way away from the heart. And as you pump along, the sugar will accumulate more in the distal area like that, and the extra sugar actually presses down and crushes those nerves. Got to change that. Another thing is immune malfunction. People get an autoimmune response to something. They're eating something in the environment. The body starts to function bad, and it'll attack itself. Sometimes it'll attack the thyroid or your adrenal glands. It could attack your nerves or your brain. People get inflammation in the brain because the immune system is attacking your own body. And if that's the case, you need to address that. And that's something else we do with functional care. You can have thyroid and adrenal problems. Every single cell in your body's got thyroid receptors. T3 has to get into the cell to give it energy. Every cell has got a cortisol receptor. And if you've got too much of any of these or too little of these, the cell will not work right, and these things cause neuropathies. You need to identify these and find out if that's causing your neuropathy. Another thing is chronic inflammation and infections. And these are usually caused by inflammatory foods or food sensitivities. American diet's not the best, and also our food's not the best. We're doing so much with genetically modifying our foods and hybridizing them to where, I mean, wheat used to grow 4.5 feet tall and blow in the wind, and now it grows 1.5 feet and is something out of a chemistry lab, and like we're all a bunch of lab rats. I mean, if you go to the store, you look at all these gluten-free foods, it's because wheat is not the wheat you ate 20 years ago. And it's just been hybridized so much that the body will look at it and it causes, look at it as a foreign protein, and it causes inflammation in the body, sometimes autoimmune responses. Another thing about America is that our omega ratio of omega fatty acids is off. Omega-3 to omega-6, our diets are typically really high in omega-6s, and it's very, very inflammatory and actually causes a breakdown of the fatty lining of the nerves, the fatty line that covers the nerves. So in a nutshell, we want to get the inflammation out. If it's like having your house on fire, you can't build a house if it's on fire. So we need to squelch the inflammation. We have to identify what the inflammation is and then squelch it. So how does it all happen? What goes on? Basically, when you're born, your body is working great. You see little kids, where do they get their energy from? They're off running around and just nonstop go, 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 go. You think, wow, you know, these little kids, but your body is working well, and the body was made to work really, really well. Well, from day one, we're all subjected to stressors, chemical, physical, and emotional stressors. Chemical stressors, wow, in our society. The chemicals, herbicides, hormones in the food, there's so much we do, there's so much in our ecosystem that no one can avoid it. Emotional stressors, wow, school, I mean, just living life is very stressful. I mean, if you ask most Americans, they're going to say, I'm stressed. It's not healthy. And then there's physical stressors, which would be falling off of jungle gyms, automobile accidents, sleeping all crooked, being on a computer all day. These things stress you. Well, your body will stand up to that stress for so long. And as it beats and beats and beats at you, you get to the point where your body just can't take it anymore. And what it'll do is it'll malfunction. One of those little gears will start to get tired out and not work right, and your body starts not to work right. And what it's going to do when it malfunctions is it's going to give you a symptom. It's very natural. It's kind of like in your car when you're driving along, you get those lights pop up. The lights are telling you something's wrong, something's wrong. Well, your body's telling you something's wrong. You know, do something about it. So let's give you an example of that and how we do this in America. Let's say your body malfunctions and you get headaches. You go to your doctor and you say, Doctor, I get these horrible headaches. My neck hurts, my head hurts. Bright lights bother me. I get nauseous, I vomit. And your doctor's going to say, wow, that's migraine headaches. Well, we have all kinds of drugs for that. We got Amitrex, Percocet. We're even giving Botox injections for that now. So they give you the medication or whatnot, and hopefully it relieves your headache. But you have to ask yourself, what did that do to address what caused the headache in the first place? Really nothing. So here you have a body with a gear that's bad, not working right, and you're treating the symptom of that with a medication. It's kind of like on the dashboard I talked about, putting a black piece of tape over the light that's shining. You say, well, I fixed that. So you're down the road, your body's malfunctioning, another gear goes bad, and let's say you get acid reflux. You go to your doctor, oh, my gut hurts, it burns, I get gas, bloating. And he says, acid reflux, all kinds of drugs for that. We got Prilosec and Nexium and the purple pill, I mean, all kinds of drugs. Gives you the drug, hopefully relieves your symptom, but has done nothing to address the malfunction. Leave time go on, another symptom. Let's say you get peripheral neuropathy. You go to your doctor and tell him about the numbness and tingling that you have. Oh wow, we got Lyrica, Cymbalta, Neurontin, all kinds of drugs for that. and hopefully it relieves your symptoms. But if you're like most people that come to my office, it doesn't. That's why you're talking to me. Well, you got to look at this and say, none of this fixes the malfunction. And here you are taking 3 different medications, all to maintain a poor quality of life. I have patients come in my office taking 8, 9 medications, all treating symptoms, not fixing what's wrong. If the medication fixed it, you wouldn't need to keep taking the medication anymore. Here's the problem. The World Health Organization will tell you that the United States is #1 in crisis acute medical care, and we are good at that. If you're in an accident, you need a surgery, some kind of a trauma, there's no place better to be in a United States hospital. We're good at that. Those same studies, though, will tell you that we rank 37th in the world in health, that there's 36 other nations whose population is healthier than us. They don't have these chronic degenerative conditions like diabetes, peripheral neuropathies, chronic fatigue, fibromyalgias. They don't have them. You have to ask yourself, why is that? The problem is that we treat all medical conditions with our acute protocols. You have a problem, you treat it with a drug. And sometimes you absolutely need that to keep your heart beating, and that's a good thing. But if it's just masking a symptom and not fixing your malfunction, what good is it doing you? This is where integrative care is so important in functional medicine. Find out what's wrong and fix what's wrong. Another example to give you an idea of this is to say, if someone came to you on January 1st and said, we're making New Year's resolutions, what would you do this year to be more healthy? I don't think any of you would say, take more medication. I mean, you watch TV and watch the commercial with the side effects. I mean, you think, why would you take it in the first place? Okay, all chronic conditions have common threads. So whether you have neuropathy, diabetes, weight loss resistance, insomnia, IBS, whatever, there's some common areas we find involved. First off, we're going to find that people have troubles with their adrenal glands, their thyroid glands, they have brain malfunction, sugar imbalances, anemias, hidden anemias, inflammation in the body. And we need to find out which one of those are going on in your body to determine what is causing your neuropathy. And to do that, we do complete testing. So oftentimes I have people come back and say to me, they've run all the tests and there's nothing wrong with me. They say it's normal. Well, that's frustrating because you think, well, why am I hurting so bad if I'm normal? Well, this is the reason why. When you go and have a blood test done, it comes back with a lab range, and it's what's called a lab average. And so it may say your test should be between 20 and 100. And the way they determine those numbers is that it's basically a lab range. If they had 100,000 people come in their lab the year before, they take all the results and divide them by 100,000. And so the average person coming in there has this bell curve. Well, you got to ask yourself something. Is that normal or is that not normal? Who goes down to a lab to have their blood tested? A healthy 18-year-old male athletes or people with AIDS, cirrhosis, diabetes, all kinds of different diseases? That normal that you get back in that blood test is really normal for the sick person that goes down to that lab. Well, from an integrative approach, that's not acceptable. So the Endocrine Society and the American Academy of Clinical Chemists got together and they tested a large group of healthy adults. And what they found was that those ranges were way too broad, that healthy people's ranges were actually narrower. And every single test you do has a functional range and a lab range. I'm going to give you an example of that. This example is with TSH, which is thyroid stimulating hormone. At Quest Labs in Tallahassee, it should be 0.45 to 4.5. And if you fall within this range, you have a normal test result. Well, functionally, it should be 1.8 to 3.0. So if you fall in this area here where this red star is, or over here, you have a normal test result. But you're normal for sick people, not healthy people. And this is where people fall between the cracks. They come in either they're tired of all these different symptoms, neuropathies and fatigue and such, and they say, well, no one knows what's wrong with me. It's because you're in this position here, and you're invisible on the radar. So when we do blood tests and see them come in, we put them into what are called functional ranges. And if you're in here, it's telling us you need support. But every single lab test has a functional range. So if you have neuropathy in both feet or both hands, that's a sign that your neuropathy is caused by a metabolic dysfunction. And if that's the case, proper testing is essential. You have to do it. And we run a complete metabolic profile. We look at all your blood cells. We look for anemias, a thyroid panel, immune panels. We want to see lipid panels, blood sugar levels. We want to know what your kidneys are doing. Do you have any hidden anemias, B12 or iron? What are your vitamin D levels doing? These things are all so critical in how your body is functioning and looking at all the gears to see which one's not working right, causing your neuropathy. We run 60 to 70 different tests. It's very extensive. And then after that, we would also be running something called an adrenal stress index test. And this is a test, it's a 12-hour test where we look at cortisol levels. And you should have what's called a circadian rhythm, where cortisol's high in the morning and it goes down during the day. Most people with problems with their health have it inverted, where it's low in the morning and high at the end of the day. And these people typically have blood sugar problems, insomnia. What we would want to do is we want to reverse that back to where it should be, a normal circadian rhythm. Another thing we test for through blood work, it would be food sensitivities. And lots of people are sensitive to foods, and there's lots of different foods, but the 5 main ones are going to be gluten, which is wheat products. You can have a problem with dairy, soy, yeast, and eggs. And these foods can cause inflammation in your system, so we need to know that. Another thing we do is we can do a gut profile test, where we can test you and see if you have parasites, viruses, bacteria, heavy metals like mercury and lead. You can have candida, yeast in your gut, parasites. Most people don't have parasites in their gut, although a lot of times people tell you it's normal too, but they can cause inflammation. So we want to identify that and then get rid of it. So all cases that come in here with any kind of a chronic condition are treated with neurologic and metabolic therapy. So let's talk about the neurological therapy. Basically, when we do a functional neurological exam, we want to see how the brain is functioning. Is it working right? And we want to do that because the brain goes down to the cerebellum, which is the lower brain, and goes out through the spine and goes out to the feet and nerves. That pathway has got to be working right. It's got to be competent. If it's not, you're going to have a problem. So with neurological imbalances, what should happen is you should have a certain what's called frequency of firing. So the brain, the right side of the brain may be firing 6 million signals to one side, and the sleeping side of the brain may be answering with just 2 million or 3 million. And if that sleeping side are sending the signals over that squelch pain, I mean, you're hurting because the brain is sleeping. And if we wake that brain up, it'll take the problem away. And so we want to evaluate the function of your brain. So we would intervene with different type of neurological therapies. And neurological therapies, there's just tons of different therapies we use. And they're all geared toward, if in the exam we find that you have a parietal lobe that's has a lower frequency of firing on the left side than the right side, we stimulate that. And we give you home care where you might be listening to music in one ear, smelling sweet smells in one nostril. There's different things you do for this. And it's amazing how fast the brain can respond to this. So by doing these different therapies, we want to make sure that the brain is on the left side, is talking equally to the right side. They're both awake and happy. So really, what does it take to fix a nerve, repair it, give it, make it revive? There's 2 things nerves need: fuel and activation. Now it's going to get all the fuel it wants from oxygen and food. Activation is really, really important. A nerve cell has to fire to stay alive. If it doesn't fire, it dies. Many of you are old enough to remember the old space program back in the 60s where they put the capsule up and it would land in the Indian Ocean, and they showed pictures of these astronauts coming out of this capsule, and they look kind of dopey. And the reason for that is because they were in outer space and they had no gravity. And see, just gravity itself stimulates your nerves. Your body fighting against gravity is firing nerves to keep your brain alive. And when they're in outer space, they didn't have that, and so that's, they had to get back in gravity to stimulate their brain again. So the different therapies that we use stimulate the nerve tracts to wake the brain up and get that whole connection working right again. And that's really what it takes to fix neuropathy. There are basically 4 things that we do. Spinal decompression, we use cold lasers, nerve rehab therapy, and neurological therapy. I've already talked about the neurological therapy, but let's cover the things for the spine. We do something called non-surgical spinal decompression. This is a huge machine we have. It's a medical unit that what you do is you lay down on this, and we put harnesses on you. We put a harness on your hips, and one up on your thoracic spine cage here. And so the one holds you up top, and the other one on the hips is hooked to the machine, which is hooked to a computer that will draw down on that lower piece. And it reads you 17 times a second, so it very slowly pulls and pulls. And if you tighten up, it lets go. And then when you let go, it tightens up again. And it can actually create negative 150 pounds of pressure on those discs. And so those discs and those holes down there are closed down. It helps open the hole up. And it's really great therapy. And we've had tremendous success with this. And so if you've got stenosis or bulged discs, it can actually relieve that pressure on that nerve so that the neuropathy thing can go away. The other thing we use a lot is cold laser therapy, and this is amazing therapy. It's been in the United States since 2002. They've been using it for 50 years in Europe. Amazing therapy. Usually when you think of laser therapy, you think of high-powered hot lasers that they use in surgery to cut tissue. Well, lasers on a cold laser side is a laser that's a fine, direct light, focused light, but it's not high-powered to hurt tissue. It actually promotes tissue regrowth. And they found that a 635 nanometer wavelength will actually stimulate energy inside the cell to wake the cells up and make them start making proteins. They've done lots of research with this where they can actually show you how cartilages and different tissues can actually regrow and come alive again. And there's absolutely no side effects to it. So we'll use lasers right on the back, right on the foot, on the area of the brain that's sleeping. There's a different frequency for ligaments, tendons, nerves, muscles, skin. It's amazing technology. Came from the space program, I believe. Another therapy we use is called peripheral nerve rehabilitation therapy, and this is a microcurrent therapy that sends a very specific wavelength and frequency up one leg and down the other. We attach little leads to the bottom of your feet, and it gives like a tingling sensation. Again, it doesn't hurt, and you don't feel cold laser either, by the way. And by sending these signals up the legs, it actually wakes up these nerves and makes them fire again, and wakes up that connection from the toe to the brain. Well, people, even with one application, get up and say, wow, I can feel the rug under my feet more so than I did when I started. And it, again, very, very successful in waking up these nerves, these peripheral nerves in the feet and hands. So, in a nutshell, what makes our office different? Well, we leave no stone unturned to find out the cause of your neuropathy. The why. Why do you have neuropathy? Don't treat the symptoms with drugs that have all kinds of side effects. We want to fix the cause, correct the function, give you your life back. So how are we going to help your neuropathy? Again, in summary, basically we're going to go do a lab test, again, blood tests, like 60 different tests, and we're going to find the cause, the metabolic causes of your neuropathy. Then we're going to remove those causes. Once we remove the causes, then we're going to go ahead and repair the tissue with specific nutrients. We may use vitamins, minerals, herbs, homeopathics, and they're going to be delivered either by capsule, by mouth, or you may have a little tablet to put under your tongue to dissolve, maybe a liquid under the tongue, or you may use a transdermal cream where you rub a cream into your elbow crease or behind your knee, and it'll absorb right through the skin into your bloodstream. Also then on the neurological side, we'll do a very thorough, complete functional neurological exam and see if there's any frequency of firing problems between one side of the brain and the other, anything wrong with the connection between the brain and the foot or the hands. And then we're going to go ahead and improve those functions with specific neurologic therapies. This is a story, 93 living life. My second year of practice, this guy comes in my office. He's 93 years old, weighed 100 pounds wet. And he's followed in by his 94-year-old wife. They've been married 71 years, and they're so cute. He said he accused her of robbing the cradle. Well, he walks in limping with his hand on his hip, says, "Doc, you got to help me. My back is killing me." I said, "Well, let's take you on back." We took him back and looked at him, and I worked on him. And he gets up off the table and says, "I think I feel better already." I said, "Great. Let's take you back up front here and schedule up another appointment." He goes, "What do you mean?" I said, "Well, I want to check you next week to make sure everything's okay." He said, "I can't come in next week." I said, "Well, why not?" He says, "I'm too busy." And she says, "He is too busy." And she pulls up this planner, puts it on the countertop, and opens it up. And I'll be darned, this guy's got something penciled in every single hour, 5 days a week, for the next 2 weeks. And I look at it, he says, "Doc, you know what I do on Fridays? I go down to the senior center to visit the old folks." I thought, that's great. He played double-level chess with one of the gentlemen there. And I'm thinking, that's the way I want to be when I'm 93 years old. This guy's my hero. I mean, no crutches, no canes, no walkers, no wheelchairs. This guy is living life and enjoying it. And the human body was made to work and work right. And we don't need to have these chronic, debilitating problems when we have the answers at hand. That being said, let's bust some myths, because I get some answers back from people that I just, I'm too old to get better. I mean, how old is too old to get better? You've got life within you. The body was made to heal itself. The body was made to work a lifetime. If you're 85 years old, do you want to spend the next year, 6 months, 6 years, 10 years miserable? I mean, it makes no sense to think I'm too old to get better. The body can heal. I've seen bad cases get better. Another myth we get is called it's genetic. And I hear this a lot. You know, my grandfather had neuropathy, my father had it, so I have it. Well, I mean, you may have inherited some neuropathy gene which they've never identified, but you also inhabit lifestyles and different things, and it can be a food or something you do that makes your nerves go bad. And we can identify that and change that. So to say that it's genetic isn't necessarily true. Another thing is there's an area of medical science now called epigenetics, where they're actually finding that doing something called, there are things called methyl groups that you can put into your diet that actually will repair the kinks in the DNA chain to where, let's say, if you have lupus, maybe you won't exhibit a severe amount of symptoms with it. So there's lots of studies going on here, and to think that you're genetically bad and you're done for is inaccurate thinking. Don't use that as an excuse. And my least favorite one is learn to live with it. Doc, I've been to Shands, Mayo, everywhere. They tell me there's nothing that can be done for me. Learn to live with it. I can't tell you how many people I've had that have been to Shands, been to Mayo that got better. I mean, they do what they do and they do it well, and I love them for it. And if I need that, I want that. But chronic conditions, you need to be looked at from a functional basis, from an integrative basis, because I had lots and lots of people get better that have been told there's no hope for you. So instead of saying learn to live with it, they're telling you learn to suffer. Well, it doesn't need to be. Key points from this talk: you need to address the metabolic and the neurologic problems to fix your neuropathy. This condition is progressive. I mean, if you talk to anybody with neuropathy, they're going to tell you, started in my big toe, got to the other toes, went up the foot, up the calf, to the thighs, to the fingers. I mean, it just keeps on getting worse. And no matter what kind of drugs they take, it keeps on getting worse. Our neuropathy program is very unique, very comprehensive, and very successful. It's effective. It works really, really well. So let's encounter a couple questions that people ask all the time. First is, how long does it take to get better? Good question. Well, the answer is it depends upon how many gears are bad in your body. If you've got 1 gear down, it's not going to take too long. If you've got 6 gears down or 12 gears down, it's going to take you longer. Usually we're going to tell people 3 to 12 months for you to heal up. That being said, I've had people in just 30 days say, wow, I can't believe how much relief I have to the misery I was having. The next is, how much does it cost? And that again depends entirely upon what's wrong with you. If you've got 1 gear bad or 12 gears bad, it runs the gamut. That being said, we find that 95% of the people that come to our office can afford care. If you can afford $80 to $120 a month, you can afford to get better. You're worth it. Does my insurance cover this type of care? It's the first question we get. And the answer to that is simply no, they do not. And most people find that very frustrating. I find it very frustrating. I have insurance, and it doesn't cover any type of care I want to get. Now, I'm glad to have it if I have an acute problem and I can go to the experts, the medical people that do so well with that. Great to have. But when you've got a chronic condition, or you want to do something that's alternative or doesn't use drugs, doesn't use surgery, they don't cover it. They don't cover LASIK eye surgery, bracing teeth. They do not cover functional, integrative type care like this. It's just off the radar. They're not going to pay for you to take a vitamin or do things like this. It's just, they don't do it. You got to ask yourself, am I worth doing something else? You've been doing the standard of care. Standard medical care has gotten you where you are today. Maybe you need to think outside the box and say, you know, if I keep doing that, I'm never going to get better. And isn't it worth it to get better? People will go out and they'll buy a new car. They'll buy a large screen TV, go on a vacation, go on a cruise. I mean, why not spend some money to get yourself well so you can enjoy life? You're worth it. You really are. So what do you get out of this? Over the years, I just love this type of care because what we really like is see someone come in miserable and just change their lives. It's why we come into work. And you'll find my staff, they're very good and they're enthusiastic and we cheer you on and we just love seeing you get your life back. We got people come back in and saying, wow, I can go shopping now, my feet don't hurt. I want to go play with my grandkids. I want to take a trip to Seattle. I never even wanted to go before because I was so miserable and I know it'd be worse if I took a trip. I'm out golfing again. I'm sleeping through the night. I don't have to depend upon my wife to do things for me. I'm back in the garden again. Just, you can enjoy life again. Life is sweet, it's short. Why be miserable? The answers to these chronic problems, the answers are available. So what's next? What do? Schedule a consultation. What you do is we'll have you come in, and because you listen to this talk, there's no cost for your consultation. You'll come in, we'll talk to you about your problem and what your goals are, what your concerns are. Then we're going to have you bring in any current blood tests you have, whether they're less than 6 months old. And before this appointment, we want you to send them to us, and what we'll do is we'll put them in our computer and put your blood test results into a functional range. So we'll know we'll compare you to healthy people. And there's also like 3 questionnaires we have to ask a lot of questions, and these questions are geared toward body systems. And so there's a group of questions that may tell us you're having trouble with your colon, your gallbladder, your small intestine, your liver. And we use that symptom-wise, and we compare that to blood tests to give us a better idea of what's going on with you. Now, as we look at all those and we say, you would be a good candidate for this type of care, at that point in time we'd say, yes, it's worthwhile to do a functional neurological exam. And we would then do that exam. You go check out at the front desk and we'd schedule you for a second visit. On that second visit, we would tell you whether we accept your case. If we think we're going to help you and change your life, we're going to take your case. If we don't, we're going to tell you that as well. So on that second visit, we'll give you an outline of any other testing that may need to be done. Maybe you need some gut testing or cortisol testing or some more blood tests or whatever it is, we would tell you that. Then we would go over all the exam findings, looking at the brain imbalances and the functional neurology that we did on day 1. And then we're going to talk about the treatment plan, what you need to do to get better. And then we're going to talk to you all about financially what it costs to do this. So things to think about. On a scale of 1 to 10, how serious is your problem? If you're an 8 to a 10, you're probably a good candidate for care. If you're a 1, probably not, because only serious-minded people need to jump on this and say, hey, I got to do something about this. I mean, how has this affected your life? How has it affected your family, your people around you, your loved ones? I mean, chronic conditions affect lots of different people, not just the person with it. And where do you see yourself in 3 to 5 years? I mean, where's this going? So again, we encourage you to schedule a consultation. Let's find out if we can help you and make a difference in your life. That's what our office is about. That's what we live off of. We'd like to change your life, add quality to your life. I hope you've enjoyed this talk. If you have any questions that you have for us, you can call our office. We encourage you to schedule an appointment so that we might be able to make a difference in your life. You have a great day. Thank you for listening. Bye.